We're always trying to improve the standard of care that we currently provide. We've had great patient and staff feedback.
The advantage of the new digital system is that the tablet will read the entire form to me, and so I get a fuller understanding of what's going on.
Here at the Trust, we're committed to using digital technology to improve the experiences of both patients and clinicians alike. Today, we will hear from Dr. Christopher Bull, pain management consultant, about how the Trust is moving away from the traditional paper-based consent for patients coming into our hospitals to a new digital process. He'll tell us how this provides not only a better patient experience, but also minimises the risks of cancellations and delays. We'll also hear from patient Stuart Ross, who worked with the Trust to ensure that the process was accessible to visually impaired patients.
In the Pain Management Centre at St Luke's, we've been trialling digital consent. Now this is to replace our traditional paper-based consent process that we currently use. So with the new digital consent, the consent is sent to the patient's email address and also phone, and they can sign this remotely and access leaflets and information as required. We're always trying to improve the standard of care that we currently provide. With the old traditional paper-based process, we would sign a consent form with the patient and then the patient would go home with that. Often when they would come back for the day of surgery, they would forget the consent form. And also the consent form needed scanning into the patient's electronic record, which sometimes got missed.
I am classed as severely visually impaired. I am a member of Bradford Association of Visually Impaired and a volunteer campaign coordinator for the RNIB. When the Bradford Association of Visually Impaired heard that the Bradford Trust was moving from a paper-based to a digital consent process, we wanted to get involved. We wanted to make sure that this new process was accessible to those with a visual impairment. In the past, when I had procedures done, the paper form was explained to me and then I was asked to sign it. I couldn't read the form. I was really dependent on the consultant or the person doing the operation to explain exactly what was going on.
The patient benefits include the fact that they can have remote access to the consent form. And once they sign it, it is securely uploaded to their electronic patient record.
The advantage of the new digital system is that the tablet will read the entire form to me, and so I get a fuller understanding of what's going on.
Are you ready to consent? Heading level 2. Consent to treatment means that you must give permission before you receive any type of medical treatment. For consent to be valid, it must be voluntary and informed.
In addition, I can get a link to that form at home, and I can sit down with relatives. We can discuss what the procedure is going to be.
There's many benefits to staff members. The digital consent is quick and intuitive to use. We can make bespoke templates for a specific type of operation. This reduces errors in consenting, and once they're stored, they are stored for Bradford teaching hospitals, so they will not be changed. So you can access them during the consultation. For an example, in the Pain Management Centre, if somebody requires an epidural to treat their pain symptoms, we have a bespoke form already created for epidurals. When we access this form, all the risks and complications are automatically added onto the consent form, so it is quick and easy to use. The trial has gone really well. We've had great patient and staff feedback. We're now going to implement it trust-wide across both medical and surgical specialities.